Style expert Jeannie Mai is here taking a break from our makeover backstage. She's going to help us tell you when you need to drive to the drugstore versus when you need to dial your doc. And let's start over here with thinning eyelashes.
Yes.
So what is one of the major causes of thinning eyelashes?
Well, one of the major causes is to actually be rough-handed with removing eye makeup.
It's hard to get off if you have like the waterproof mascara.
Exactly, which is why you should be using an oil-based makeup remover. But being too rough-handed with your actual curler can also get those lashes to just stick to the curler and completely be yanked out.
But that's just from the way you're applying your makeup, being a little too rough with your eyelashes. But as you look, if you look at eyelashes, I'm just gonna run over here really quickly. All these hair follicles, you see them. They can become inflamed and it can cause something called blepharitis, which is more of a medical problem. That's inflammation and swelling, as you see in this picture. It'll cause that redness. Usually, if it's not a severe case, it will improve on its own. You can use everything from warm compresses to gentle baby shampoo to wash the area, and it should resolve. Absolutely. If it doesn't, and it gets really red and it's getting worse, that's when the trip to the drugstore is not what you want to do. You want to talk to your doc.
Go see your ophthalmologist, probably.
Well, not just that, because there
Or
can be
regular
other
doc.
things, because it may be related to thyroid, so they may need to ask their doctors for a thyroid panel. Also, if it's related to thinning of the hair on your head as well, it could be related to alopecia.
That's right. So if it's just the lashes,
Yes.
that's beauty.
Yes.
But if it really is dealing with the eyelid itself and the inflammation is in the eyelid, that is more of a doctor question.
For sure.
Well, let's move on from lashes to something else. There's a reason why I have a massive lip over here. Guess what the #1 cause of chapped lips happens to be? Believe it or not, it's dehydration. And I'm going to go to my chapped lip. We'll see how this looks, if I may.
You guys have the coolest toys.
Yeah, but you have to apply it correctly. So, since dehydration is the major cause of chapped lips,
Yes.
what are the solutions?
The first thing you want to do is to actually read the ingredients in your lip ointment or your lip balms to find that they're natural ingredients and natural oils in there to actually naturally moisturize your lips.
Common theme here, same thing with your eyelashes.
Completely. Yeah, because a lot of lip balms, I mean, when you put lip gloss on your lips to moisturize, that's not moisturizing. That's makeup. There's fragrance, there's fake colors.
Right, it's not actually helping
That's
your
not
lips.
actually going to moisturize. So
That
you
can
need to make
dry
sure,
out.
right, you need to make sure you have, you know, beeswax or almond oils or shea butter to moisturize your lips.
So look at the ingredients. These are some things you may want to avoid because they can be irritants, certainly not for everyone, but phenol, camphor, peppermint, and lanolin. For some people, they could be irritants. For others, it may be fine, but you're saying be wary because
Yes.
it could make it worse.
And I will say that there's a product here that, ladies, I'm sharing my biggest secret with you because I love you, Bag Balm. I will tell you that this is the product that farmers use to moisturize cow udders.
Okay.
Okay, so, okay,
If it's good enough for the cow udders,
That's
it's
right.
good enough for my lips, I guess.
I just wanted to warn you.
Fantastic, you are right.
Right tip?
So I want to move on from just general chapped lips to what if you have chapped lips that just is in the corner of your mouth? That's a different story. This is cheilitis here. And this is something that you need treatment maybe beyond just lip balm. Cheilitis can be caused by an infection. It can also at times be caused by a vitamin deficiency, in particular B vitamins. So this is something not to go to the drugstore for, but to go talk to your doctor. And I think
If you have something going on with your lips that's not, going away in a matter of days, it may be another condition.
Definitely.
Actinic keratosis. If you have a rough, irregular surface to your lips that's not going away like normally chapped lips would, this is basically what it is sun damage and actinic keratosis. It's a precancerous lesion, so you don't want to ignore it. There's ways to get rid of it. Laser treatments work. Retinols, Retin A will help you get rid of it. Sometimes we have to shave it, but the best thing to do is prevent it in the first place by wearing that lip balm. Make sure that your lip balm has sun protection in it, at least an SPF of 30.